UK government scrambling to make sense of new regulations from the United States. That European ban now expanded to include the UK and Ireland.
We got on an escalator and it was just absolutely there were people just piled up at the bottom.
This is what Spain's coronavirus state of emergency looks like in Madrid. With the restrictions, the capital is like a ghost town.
As of Sunday morning, public gatherings will be limited to 10 people, and all leisure and entertainment venues in Israel will be closed.
We have not reached our peak. We will see more cases and we will see more suffering and death.
Live from CNN Atlanta, this is Connect the World.
Hello, I'm Lynda Kinkade. Welcome to Connect the World. I'm sitting in for Becky Anderson this hour. Well, Europe is now the epicenter of the coronavirus pandemic, where cases are surging. More than 150,000 cases have been confirmed worldwide, over half in China, where the virus is thought to have originated. Europe, though, is struggling to manage a fast-spreading outbreak, leading to a few countries entering near total lockdown. The latest to take this drastic step is France, joining Spain and Italy. Other countries are taking similar measures of late, including Israel. And the US, of course, is tightening international travel restrictions too, as cases here multiply at a quickening pace. Tarik Jasarevic joins us now on the line. He's a spokesman for the World Health Organsiation at the forefront of combating this virus. Good to have you with us. This is unlike anything we've seen in memory. How long could this be with us?
Hello, thank you very much for inviting me. Well, as you have said, this is very unprecedented, and countries around the world are really trying to protect their population based on the best analysis they can make, and they are putting in place measures to slow down the transmission of the virus. We have seen in past days and weeks that more and more geographical areas are being affected, and that people around the world can be expected to be exposed to the virus. And this is why we have qualified this outbreak as pandemic. However, the advice from the World Health Organization is not really changing. We want all countries to get ready to test people, to try to contain the spread where possible, and to mix those measures and combine those measures with those of trying to slow down the virus with the measures like social distancing and trying to avoid mass gatherings.
We are seeing those extreme measures in so many countries now. Schools and universities shut down, employees told where possible to work from home, schools shut down, so people are effectively looking after their children at home while trying to work. Is that all enough? Because we are now hearing from the Centers for Disease Control saying it's possible that schools should close for much longer than 4 weeks, maybe 8 weeks, maybe the end of the year.
Well, it's very difficult to predict where the situation will go. On one hand, we understand countries that are trying to with these measures, slow down the progression of the virus and try to buy some time for their health systems that in many places are already overburdened. We also try to say to countries that have only few cases or countries that have not seen cases of COVID-19 to adopt measures that we know that are working, and that's to go after the virus itself and try to isolate people who are sick and look for those who have been in contact. Examples from countries like China, South Korea, and Singapore tell us that it is possible to do containment, but obviously at some point, if you have thousands of people who are sick, then you really need to go into trying to protect the population by trying to slow down the transmission.
Certainly the UK and their action plan is looking at asking people over the age of 70 to effectively stay in self-isolation for 4 months. That decision, of course, they're going to make in the coming weeks. Is that where we're headed?
Well, we know by now that people at risk are our elderly citizens, and we need to do everything to protect them. It's our responsibility to make sure that the vulnerable part of population is taken care of. Now, there are different things that could be done, and countries are looking into these things. But again, this is not to say that young people are completely free of risk. And I think the countries are giving the guidelines to their population what to do, and whatever that guidelines is, because situation in different countries is different, and the measures can be different. But it's important that population everywhere around the world really participate and they follow the advice by the national health authorities.
As far as I've read, it seems that no one under the age of 20 has been killed by this coronavirus. Is that your understanding? Because you were just sort of saying that young people are also at risk, but it seems in this instance, with this particular strain of the coronavirus, that it seems most of the worst impact, this seems most dangerous for those over the age of 60 and 70.
You are right, and this is what data we have so far is telling us. People over 60, 65 year of age are really at risk, and that the fatality ratio among those population is about 20%. However, there are still things that we don't know about this virus. We don't know how much is being transmitted by people who have very mild symptoms or no symptoms at all. So it would be really wrong to say that this crisis is touching only one part of the population, because then we are risking that other parts of population is not taking it seriously enough. So I think everyone has to follow the advice of national health authorities, and where measures of social distancing is being recommended, I think there is the obligation of each one of us to follow that.
Some countries we know are testing hundreds of thousands of people, and here in the US, of course, the administration in particular has come under a lot of criticism for not testing enough and not even having enough tests available, where people are coming from level 3 countries and having symptoms of this virus. What do you make of the United States and its response to this pandemic?
Well, this crisis is a test for every country in the world. And it's not really the time to criticize one country or another, or stigmatize population in one place of the world or another, as we have been saying from the beginning, where we had a majority of cases coming from China. This is a time of solidarity. This is the time to see how we can do
Tarik,
things together.
with all due respect, it's not so much to criticize the United States, but I'm wondering, has there been enough testing? It's that simple. Is there enough testing happening right now in the United States as far as you're concerned?
Well, I can just repeat what our guidance is, and then it is basically that countries that have a lower number of people being diagnosed with COVID-19 by laboratory testing should try really to look after virus, really try to contain the spread by finding people who are sick, what we call case finding, looking after people who have been in close contact with them, what we call contact tracing, and trying basically to locate where the virus is and try to contain it. Obviously, this has to be coupled with the measures of trying to slow down. But definitely, the advice of WHO is to try to test, because that will give us really the full picture of what the situation is in any of the countries.
Tarik, we are seeing major sporting tournaments and events being cancelled right around the world. We just heard this weekend that the Masters here in Augusta in the US has now been postponed. Obviously, the NBA has been put off, the Premier League. Time and time again, we are learning about a new sports event that has been either postponed or cancelled. The one thing we're not hearing from is regards to the Olympics, and the president of the Olympic Committee says they're going to rely on the World Health Organsiation for guidance on whether they should go ahead. What should happen? Should the Olympics be postponed or cancelled?
Well, let's be clear. It's not the role of the World Health Organization to call off any event. This is being done by the organizers, and the role of WHO is to provide a sound public health advice. Now, what we are saying is that every situation has to be looked at on a case-by-case basis, depending on what the transmission of any pathogen in the area where the event has to take place, what is the capacity of the country, what is the cultural and social context of it. So organizers have to look at it. We are in the contact with the International Olympic Committee, as we have been in many years before or previous Olympics, trying to provide really this update on the situation. But eventually, the decision will be taken by the organizers together with the International Olympic Committee. We are trying to say that there is no risk without that there is no event without risk. Sometimes this risk can be managed, and whatever decision is, it has to be proportionate to the risk.
Right. But at this point in time, given we know how this virus is spreading, I would think your guidance would be that the risk would be pretty high to have an international event like this, where you have people flying in from all over the world for one sports event.
Well, I'm sorry if I'm repeating myself, but again, you know, organizers will have to look on a particular context and make their own analysis, just as countries are doing their own analysis when they decide of closing schools or canceling cultural events. There is no blanket recommendation, really. And what we are trying to do from our side is really try to say, this is what we know about the virus. This is what we know about the transmission. This is what we know about severity, and then to see whether the risk of a transmission can be managed, or it is wiser to postpone event. In that case, try to avoid mass gathering.
All right, Tarik, Jasarevic, good to get you with us from the World Health Organsiation. Thanks so much for your time. We know you have a very busy job right now. Thank you.
Thank you.
Well, the pandemic has been causing confusion at the world's major airports. Salma Abdelaziz is at Heathrow outside London, and our Polo Sandoval is at JFK in New York. I want to start with you first, Polo, because we are seeing what seems to be absolute chaos as people try to get back to the United States quickly from Europe and the UK as a result of this Trump travel ban.
Lynda, today is day 2 of the enforcement of this travel ban and accompanying health screenings that we've seen at airports across the country. About 13 that have been established. Of course, the one behind me, JFK, is certainly one of the busiest here. Sources close to this CDC screening telling CNN that yesterday they were able to identify 3 passengers who were coming in that appeared symptomatic. They were referred to nearby hospitals here. But on average, we've reached out to the Customs and Border Protection, at least one of the main supervisors here, that says the average wait time for that CDC testing, again, that health screening that's required for all those passengers coming in from Europe, is averaging about 2 hours. And the screening, it's fairly simple here. According to these passengers have told us, they fill out a form, what's called a health declaration, that's handed to officials. They then are checked out for possible symptoms and then referred to any appropriate action should that be necessary. But it's a process that, again, only takes about a minute. However, you multiply that by the many, many passengers who use this airport and others like it to enter the country, and the result are these log jams that we've seen the last 24 hours. Now, as for the U.S. government, they are explaining that they are fully aware that this did become an issue yesterday. However, they're working with airlines to try to expedite this testing, and they're also adding additional screeners to try to make this a smoother process. Here at JFK alone, we're told there should be at least 50 medical technicians that are performing these health screenings. But ultimately, Lynda, you have to also put yourself in the position of these passengers that are deplaning and they're being crammed into a space while government officials are recommending social distancing, that you try to not get very close to people. So you can certainly imagine what the frustration has been like, the chaos, the concern, and even a little bit of confusion that we've seen here at JFK and the other airports that have been designated as entry points.
Yeah, the other airport we are seeing pretty unbelievable pictures from is Chicago's O'Hare Airport, where people, certainly, as you mentioned, there's no social distancing whatsoever. People are seriously elbow to elbow, and they have been complaining not only about being stuck in a position like that for hours, but also having no access to hand sanitizer. Do we know if people that have been tested and have high temperatures, what happens to them? Do they then go in quarantine? What's the process?
Yeah, it's a good question. We know of, again, of at least 3 people who were identified yesterday as part of this new screening protocol. We understand that they were referred to nearby hospitals here in the New York area for further assessment. And, of course, one can only imagine they will be tested for the coronavirus itself. But the way the U.S. government is seeing this is as sort of the first chance to be able to identify individuals who may have been exposed. Of course, they're handed a form, that health declaration, and ultimately it's up to them how truthful they may want to be on that. But then they have the temperature check, then they have looking out for symptoms that could potentially flag people, again, to nearest medical authorities. And then the rest of the passengers, of course, the majority of them, they're allowed to continue on their way. Again, U.S. citizens, permanent residents, and their families only.
All right, Polo Sandoval at New York at JFK Airport. Thanks so much. I want to bring in Salma Abdelaziz, who's at Heathrow, just outside Heathrow Airport. And it really was, Salma, only a matter of time before the Trump administration added the UK and Ireland to this European travel ban, but it seemed to happen pretty quickly.
That's right, Lynda. It did happen very quickly, and it did seem to come as a surprise to the UK authorities. We did get a statement from the Foreign Office saying, of course, that this is an American decision for American citizens. And when it comes to British nationals, well, they should avoid all non-essential travel to the United States. Of course, that's sort of a redundant statement, because now these new restrictions on these 28 countries mean that no foreign nationals from those countries can travel to the United States for the next few weeks. But what that statement does reflect is this sense across Europe and in the UK that the authorities in the United States are acting unilaterally, that they're not cooperating with their partners inside Europe, that in dealing with this global pandemic, when you should see global cooperation, the Trump administration is choosing an America First policy, is choosing to close its borders and to not necessarily consult with its partners across the Atlantic. And the UK today is also dealing with its own criticism of its handling of the pandemic. So really all these countries reeling. And just behind me here in Heathrow Airport, we see the fallout from that, with travelers getting new information by the hour, oftentimes feeling confused. We were speaking to American citizens inside Heathrow just yesterday, and they were saying, I don't know where to find clear and concise information on what's happening. So a lot of confusion, Lynda, as people try to make sense of all these new restrictions.
Yeah, certainly. And just a question without notice. We know, obviously, airlines in the United States are certainly cutting back on flights. Obviously, this travel ban is going to impact the bottom line for airlines right around the world. Are you hearing from airlines there in the UK about how this is going to impact them?
We are, Lynda, we are indeed. As you can see, there are still flights passing behind me here. We are still seeing airlines flying around Europe, but those flights are being restricted by the day. As you know, some countries like Spain and in Italy in partial or in full lockdowns, advice changing for people to stop all travel restrictions. And there has been an appeal here from the authorities, from airlines, saying we need clearer information. We need information so that we can provide passengers with details. Now, we have some emergency bills that have passed, some budgets that have passed from the EU and otherwise to help these airline services. But as this information changes, we will expect to see more and more details on how the government will support these businesses, Lynda.
All right, Salma Abdelaziz outside Heathrow Airport in London. Thanks so much. Well, let's get you up to speed on some other stories on our radar right now. Now, starting tomorrow, Nike is closing its stores in the United States, Canada, Western Europe, Australia and New Zealand to help stop the spread of the coronavirus. The company's stores in South Korea, Japan and most of China are staying open for now. And in the Philippines, 5 cities in Manila region have announced a daily curfew. Now, officials say the new policy does go into effect Sunday from 8 p.m. to 5 a.m. in the morning. Now, this comes just a few days after President Rodrigo Duterte announced the Metro Manila area would suspend all means of transportation for a month. And this just into CNN, Morocco's foreign ministry is suspending all international flights to and from the country until further notice. Morocco currently has 3 counted cases of the coronavirus. We'll bring you more on this as it comes to hand. Well, symptom-free and still spreading the coronavirus. Officials initially said it could happen, but not at a significant rate. But recent studies reveal much different results. Reports show that more than 80 cases in the U.S. state of Massachusetts were transmitted by people who were not showing any symptoms. Well, for more information on how the virus spreads, visit us online at CNN.com. Still to come on Connect the World, the President of the United States doesn't have the virus, at least for now. So what is he doing to help Americans get tested? Plus...
And so we want to make sure that we rally around everyone and ensure that these kids are not wondering where their next meal is coming from.
Using their star power to feed thousands of out-of-school kids during the coronavirus outbreak, we're going to look at more ways people are tackling COVID-19 with good deeds.